Do you have a binge eating disorder? If the answer is no, well, good for you. But just to make sure, here are some diagnostic procedures for binge eating or binge eating disorders. Now, you probably have a binge eating disorder if you have recurrent binge eating episodes. That means if you eat a large amount of food within a short period of time. For example, within 2 hours, you've consumed a day's worth of food or a day's worth of intake that you're supposed to have per day, and then you have that within a period of 2 hours, or just in the morning, or just at one sitting. It's not a buffet, so make sure that you spread out your eating. The second one, certain peculiar behaviors. Now, if you have at least 3 of the following, then it is considered that someone may be having a binge eating disorder. Eating rapidly or eating fast, you're not in a competition with anyone, take your time, eat slowly. Eating large amounts of food even when you're not hungry. Eating until you become uncomfortable. You know, when you have to button that so that you can breathe, while eating up until you become uncomfortably. Eating large amounts of food until you become uncomfortable. Eating alone due to embarrassment or feeling like people will judge you based on what you're eating or how much you're eating, so you try to hide that type of food that you're going to be consuming. Feeling disgusted, depressed, or sad after consuming that large meal that you know you were not supposed to have. So you eat the food and then immediately afterward you regret having that food or that type of food, and then you just feel depressed or guilty or sad, whatever it may be, but then sad thoughts. The third one is frequency and duration. Now, this may come as a surprise to a lot of people because binge eating disorder is categorized as having a binge episode at least once a week within a period of 3 months. So that means if you binge eat once within a week, or each and every week for 3 months, then it's considered binge eating. So obviously now, if you're having multiple binge eating episodes each and every week, more than once a week, then it is considered binge eating. It's only gonna get worse or more from here on, so make sure that you control it while it's still a little. But it's categorized as having a binge episode at least once a week within a period of 3 months. Not 3 months exactly, but then every week is once for 3 months. Hope that makes sense. Now, often binge eating disorders come with health complications such as poor self-image or poor body image, and then this can lead to a low self-esteem and dissatisfaction with weight or how your weight looks. Binge eating is an illness that can have severe health consequences. Now, there are different things. So the first one I'll name is weight gain or obesity. Now, weight gain or obesity can lead to long life risk diseases or health issues such as sleep apnea or having difficulty breathing, heart disease, type 2 diabetes, as I said before, poor self-image, which can lead to mental health issues such as depression and anxiety. But there's hope after all for all this binge eating disorders. Now, there are certain things that you can do to make sure that you curb that so that you do not go down that road. And then you make sure that you take care of your health, take care of your body. It is the only place that you have to live. Now, the first one that you can do is make sure that you see a dietitian. You can't get help over a YouTube video, but you can get guidance. So this is just guidance or tips, information to give out. This is not a consultation for you to take home. So the best treatment or solution in a way is to make sure that you see a dietitian. So you go and see a dietitian. I know someone by the name of Terry, so where you will do online consultation to help you with your binge eating episodes. That way you help manage it and then prevent it, and then you make sure that you take care of your body, all in the comfort of your own home, as all the consultations can be done online with regular follow-ups and checkups to see how you're doing along the way. The second one, avoid meal skipping. So it is best to have regular frequent meals throughout the day. That way you avoid having large amounts of food. As you are always consuming something, make sure that you're consuming something within the proper portions, and that way you're always having something to eat while it's in the right portions, and then you avoid overeating, because usually if someone is eating at least like 2 times a day or once a day, chances of them having large amount of food at that one sitting to compensate for all the times that they missed, it usually happens. So make sure that you have regular eating pattern, you avoid skipping meals. It's very important. The third one is change your environment, or change your cupboard or your kitchen, whatever it may be, because you cannot binge eat on chocolates if there are no chocolates to binge on. Buy yourself maybe a kiddies bar, something that you know you won't overeat, and 15 apples. You're trying to change your mindset. Now, if you're thinking, oh, this is not the way life is supposed to be, I'm supposed to enjoy my food. Yes, that's true. But if you know you cannot control yourself, so make sure that you do not have access to that food for the time being, while you're trying to implement different food or textures of food or different healthy food into your diet. That way you make sure that you're trying to have more healthy alternatives as to unhealthy. Having few triggers around your environment can make it easy to resist the temptations of binge eating. Now, the fourth one is exercise. Make sure that you exercise on the regular. So exercise, you are more likely to stay consistent on your diet, on your healthy diet, when you're exercising, especially if you exercise and then you take weekly or monthly progresses in terms of pictures or monitoring your weight. But as you are seeing that effect or how it's actually working, you're more likely to stay consistent to your diet, because you do not want to go back to the food that will make you inconsistent in your exercise or your body goals. So with the regular exercises, you're more likely to eat healthy food as opposed to or binge eating unhealthy food. So it does help in terms of your mentality in the type of food that you choose or you want to choose. Exercise does help with healthy eating or eating healthy, because you want to make sure that you're continuously taking care of your body to lift better or more weights than before, or run faster than before, whatever it may be. But exercise does help. Healthcare professionals are there to support and give best guidance for them. That sounds different. Anyway, make sure that you help yourself, take care of your body. It is the only place that you have to live. Please like the video, make sure that you share the video, and I'll see you in the next one. Thank you.